All right. Hello, everybody, and welcome to our webinar tonight on trying to conceive during a pandemic. I have with me Dr. Kenneth Gelman. We're going to welcome everybody to the room.
Welcome.
And yes, and also we'll be taking your questions after our webinar tonight. So let me just go ahead and make sure I can see everybody and see everything here. I'm going to actually join from my phone as well so I can see. So Dr. Gelman, you're good. You can see everything right now. And
I don't see anybody other than you right now. But
okay, well, yes, we'll be chatting here in our window, and I'm actually just looking to see how I can. Oh, okay, yes, I can see everybody now. So go ahead and type in the chat where you're from. And I have Lori and Nisha here. So hello, guys. Welcome. If you want to share where you're watching from, that would be great. And we're going to also have a Q&A session. We do have a Q&A tab that's there, so you can actually type in your questions. Welcome, Aya. Thanks for joining us tonight. Lolo's here. Hello. So welcome, everybody. You can go ahead and type in hi in the chat and type in how you're coping with quarantine right now, how everybody's doing right now. And looks like we, okay, so we do have a Q&A tab, and we also have, let me see if we can look at our chat. Yes, we do have a chat tab. So Dr. Gelman, are you able to see the chat tab, or are you able to look?
No, I'm not.
Okay, so that's okay. We'll look at here. Oh, perfect. Okay, Lori's watching from Orlando. Nisha's in Pembroke Pines. Welcome, welcome. And I'm in Miami. Dr. Gelman's in Fort Lauderdale, Pembroke Pines, Cooper City, Broward area.
Right.
So,
Farrar.
We're going to wait just for a few minutes to give everybody time to come on. And we're going to get started very shortly here. So we're tonight going to actually be discussing something that has been evolving day after day, week after week. We get new information all the time. So I want to make sure that we give you guys the most current information that we're discovering as well. And that's why we're doing a joint webinar tonight. So Dr. Gelman is with me tonight. He's actually going to be discussing what his patients are going through are at IVFMD, and we're also going to be discussing what you can do in the meantime if you are on hold for a treatment cycle to actually increase and enhance your fertility while in the meantime. And I know that there's been questions that have been emailed to us. We're going to actually get to all the questions after the presentation, so you can type them in the Q&A tab. And that would be great if you could do that. And also, if you want to use a chat tab, that's fine, just in case you have any issues with sound or anything like that. Welcome to do that. But I would just ask you to keep your questions in the Q&A tab so that we can answer them at the end. All right. So we're going to get started, and I want to share with you guys where I'm from. I'm from Florida Complete Wellness. I'm a licensed acupuncture physician. And we're going to actually be talking a little bit about, again, natural strategies you can do to enhance your fertility. And also we're talking with Dr. Kenneth Gelman from IVFMD, who's going to talk to us about the new guidelines that are out for couples that are trying to conceive or who are trying to await a medicated cycle, and also what to do in the meantime. So welcome, Dr. Gelman, and welcome everybody. So let's go ahead, and we are going to get started. So just a disclaimer here, I want you guys to know that the information that we're presenting tonight is an informative resource only, and it's not to be used or relied upon for any diagnostic or treatment purposes. And this lecture contains general information about medical conditions and treatments, and it's not advice and should not be treated as such. The information is not intended to be patient education and does not create any patient-physician relationship. So just make sure, we would love to hear your feedback, and we're going to give you some awesome tips, but I want you to communicate your decisions with your providers as well, everyone that you're working with. Okay. So if you are confused right now, you are not alone. There has been so much confusion around COVID-19 in the first place, and also around who's open, where do we go, and what do we do? So tonight, we really hope to clear up some of that confusion and hopefully give you guys a sense of calm and peace around what decisions you'll be making in the next few weeks or months. And there's still a lot of things that are not known, but we are going to talk about the things that are known. And I'm with Dr. Kenneth Gelman tonight. He's a reproductive specialist at IVFMD in Cooper City in Miami. And his area of focus is all reproductive endocrinology procedures, as well as the area of women's menopause. He's worked with our patients for several years now, and he definitely has done a lot of work with us on our PCOS podcast, and worked with so many of our patients with IVF and IUI and all kinds of procedures as well. So I'm really glad to have him on here. And I am the founder and acupuncture physician at Florida Complete Wellness, and I've been practicing since 2001. And my area of focus is infertility, PCOS, endometriosis, pregnancy, and autoimmune disorders. And my passion is definitely helping men and women with conception. So we're going to talk a little bit about the questions we've been getting, and hope to answer these tonight. So this is what I've been hearing in the with our telemedicine visits, and also through email with a lot of our patients, is that right now everyone feels like they're alone, and really it's been really tough to know what's going on. And what about waiting? Are they gonna miss the fertile window if you're waiting? And also, what about if this never happens for me? What choices will I be left with? So there is definitely some areas that are a little gray as far as, what's going to happen. So the challenge is that each month that passes, it leads to more and more frustration. You feel emotionally drained when you see another negative pregnancy test again. And advice from family and friends can be very confusing. You're wondering when life will get back to normal. And that's what we're all wondering and hoping that will happen soon. So do you guys, does anybody have, does this sound familiar at all, or has anyone been experiencing this lately? Or you can type it in the chat. And I hope that, if you are feeling alone, just know that you're not alone. We're here, and we're here to help. So I'm going to let Dr. Gelman actually talk about why infertility is so prevalent. So Dr. Gelman, go ahead and take it away.
Well, good evening, everybody. It's great to be here. And, we're going to go over some general things and try to be a little more specific in terms of what to do during this whole pandemic episode that we're all dealing with here, and all suffering from, in every way, including all the stress factors and everything else that goes along with it. But just in general, we're also dealing with a population that potentially isn't getting pregnant, and so that is going to lead to a lot of stress on top of, having this issue, obviously. And the main issue that we want to try to, get across is that this is going to be a sort of a global approach. It's not just here, take these medications and, we'll get you pregnant right away, or, we're going to have to delay you for several weeks because of this whole thing. We want to try to give you sort of a pathway and some better ideas on, how to relax during all this and to feel confident, that things are going to happen. Whether it's, not going to be maybe not this month, but it might be very, very soon and, shortly over the summer. But we want you to feel all that you have a plan, and that you all feel confident with that plan, and that you're going to get through all this quarantine issue and feel healthier and better along, with hopefully getting pregnant sooner rather than later. So we want to try to allay your fears a little bit. I think that's the main thing we're trying to get across here. But, you know, everybody kind of knows why infertility is so prevalent. I don't think this slide adds much here. And kind of everybody knows that, you know, people are delaying getting pregnant longer. A lot of, you know, people and women in particular have careers now, and they want to delay childbearing until they're established. And that's understandable. But, you know, and many women, you know, unfortunately don't appreciate the fact that even though they have regular cycles and they're healthy, their egg quality and the amount of eggs that they produce, both the quality and the eggs, are getting lower and lower with each year. And, you know, we'll show you some graphs later showing that in some detail, but and that creates a lot of stress. And that's really what we're trying to get out here today. So the issue is, you know, should you try to get pregnant when this thing is going on? Now, the OBGYN Society basically said this, that's stated here: unless you or your partner are sick or have a clear medical reason not to get pregnant, it's okay to get pregnant. You know, especially obviously for women in their mid-30s and older, you know, obviously the delay will reduce their chances. Well, that statement was issued. So, you know, when the ASRM, and we'll see shortly what they said, came out and said that we have to stop doing everything we do, including IUIs and natural cycles and monitoring, you know, ovulation induction cycles and or IVF and retrievals, and they came out and they shut us down, you know, that was a very, well, unfair statement, let's put it that way. And it interfered directly with, you know, the patient doctor relationship, and, you know, and then different communities in different parts of the country have different exposure to these things. I can understand in New York why they did that, you know, and a lot of those places are associated with big university settings and large places. There's a lot of people, you know, that live on top of one another. And, you know, down here it's different, you know, places. So there's places in the country that have different experiences with this virus. So for them to come out with a blanket statement from the ASRM, whereas the OBGYN societies basically said it's okay for you to be home with your partner trying to conceive, it was a little discriminatory in my view. And that's what we're trying to portray or get across to all of you, what the quandaries that we're having and you're having, but also give you a sense of calm in all this. And that's what we're going to try to do tonight. Next slide.
Okay, perfect. And
so some women, you know, it may be logical for them to not want to try at this point in time. Obviously, if you're very young and you've got a lot of time, and, you know, you may want to say, listen, let's wait till this whole episode dies down and there's no further quarantine going on here. But, you know, the main thing is that most women that we see are in their mid to late 30s, and they may not have as much time to wait. And, you know, so some of these things will have to be dealt with in a positive way in terms of, you know, how do we going to have women relax and de-stress and to realize that a month or two delay really probably isn't the worst thing in the world for most of these patients. So that if you do end up deciding to delay this, in most cases, it's probably not going to be an issue, but we're going to try to help you stay healthy and to maintain your eggs or your antral follicles in a good number as before, hopefully, or even better, and keep them healthy. And that's what we're going to try to do tonight because of this whole issue. So anybody obviously with an active viral infection, you know, has fever, chills, shortness of breath, anything, you know, that's pretty obvious, they shouldn't be trying to get pregnant. I mean, I think that, you know, in those situations, that's pretty standard. I think anybody with a lot of sense would know that. And, you know, we're going to obviously try to screen people who are coming to our office to make sure they don't have any symptoms. And if you do, you're going to be turned away. You're not going to be able to come into our office and expose our personnel either. And you'll have to go home and, recover, or if you're obviously sick enough, you'll be admitted to the hospital. But again, there's no direct evidence that, conceiving with a virus would harm the pregnancy. Apparently, there's been studies that have come out, small ones though, out of China and one out of Britain, that showed that there's apparently no direct effect on the actual fertility process and won't harm the pregnancy, except, as I stated here, a high fever. If the patient has a high fever, especially in the first trimester, that might be an issue in terms of birth defects. We don't know much about the first trimester if you're pregnant. The studies have looked at patients that delivered, and they've been fine if they've gotten infected in the third trimester, but we don't know much about the first trimester. But certainly any kind of high fever might be problematic. So obviously, if you have a fever in the first trimester and you're trying to get pregnant, you may want to postpone. That would be a smart thing to do. But again, there's no definite answers on these things. This is what we know so far from a few months' experience. And obviously, they are going to be doing more research and studies on these things. Next one. Now, the men, again, we don't know a lot about what's going on with the men. A high fever in men is going to affect their sperm production as well as their sperm motility, and that could be affected for 3 months. So if a man has something like that, they probably should definitely see a urologist or come to us, get a sperm count done, get an analysis, get assessed, and then get reassessed after several months of feeling well and with no fever. Maybe take antioxidant vitamins for a few months, because a fever could definitely affect those factors, whether you have COVID or not, any kind of high fever. But we don't know if this virus affects testicular tissue. It's stated here. We don't know that. Apparently Zika does. Zika, has more of an impact, but we don't think this one does, but we are not sure of that either. But so far, other than a high fever, there doesn't seem to be a direct contraindication for the men. Excellent. Now, pregnancy, we would think you'd be more susceptible to getting this infection, but apparently that's not been shown either from the Chinese studies. So, you would think that pregnant women may have more immunosuppression going on because of all the steroid hormones. And certain diseases they may be more susceptible to, but apparently not this one. And that's obviously reassuring. And when they looked at these records of, as it said, 147 women, it concluded really that they were developing normally. The pregnancies did fine. So, they didn't really have any impact on the actual pregnancy itself. And they were not more susceptible than anybody else. But obviously, if you're trying to get pregnant, you don't want to obviously go out and increase your risk of getting this thing. You want to obviously be even more careful than you've been before and try to avoid this thing completely. And that would be my advice. So, just because the studies are reassuring doesn't mean you should go out and, not quarantine yourself. And you should probably do that even more once you're pregnant if possible. Excellent.
And this is a slide about, some people have questions about whether the COVID-19 can be transmitted to the baby during pregnancy. So if you could talk a little bit about that.
Yeah, apparently not. Apparently it doesn't seem to cross the placenta, and again, unlike Zika virus, so we think that's sort of a reassuring factor again, that the transmission is not vertical. But an infected mother, maybe passing it, an infected person who's working with that mother, or maybe, God forbid, a healthcare worker could spread it that way. So we're not sure if any of the babies did get affected, where it came from for sure, but they don't think it came from vertical spread. And apparently one infected mother had a C-section, but they're not sure where the baby actually got it from, but the baby did recover quickly. So that's obviously reassuring. But again, we don't have all that information. We don't think it's a problem though at this point. Again, it doesn't seem to be crossing the breast milk either. Again, reassuring, small studies. Again, that's all we know so far. No birth defects, but again, as I stated before, we don't know the exposure in the first trimester in these people.
Right, because this is a novel virus, there hasn't been enough time to look at all of that, right?
Right, exactly.
Well, so, yeah, this is a big question right now about, okay, every state has their own mandates as far as what is open, what's not open. So we're going to talk a little bit about if your treatment has been postponed as far as your IVF or your donor cycle or your IUI, what kind of options do you have? So, so I think this is important to mention because we're in a holding pattern, some of us, and this is really what questions we've been getting. So did you, Dr. Gelman, talk a little bit about, on your side, the telehealth option and what you've been doing with your patients?
Well, the telehealth option has actually been quite good. I initially, when I was starting to do this, I didn't think it was going to be very useful, but actually it is. It's so good, actually. Patients are like sitting right in front of you. You can have really heart-to-heart discussions about all these things. But mainly, as I try to emphasize earlier in this talk, I mean, we're trying to make sure that, if you're being, quarantined and obviously you're not able to go through treatment at this point, you shouldn't worry overly much. I think the month or so delay in most people is probably going to be fine as long as you're focusing on your own health and trying to improve things and not making things worse. So as this slide says, keeping your weight down. I think that's very important. We can have a whole talk on obesity and its influence on pregnancy and carrying the pregnancy and miscarriage risk and all kinds of things. But, obviously a healthy weight and achieving most normal BMI you can achieve, working with our lifestyles consultants, would be very, very useful here. Obviously, if you were smoking, this is a great time to quit. If you're being quarantined and this would be the perfect time to do something like that. Eating healthy with high antioxidants in your diet. I mean, healthy fruits and vegetables, those things, getting away from the sugars, would be highly advisable at this time if you were not going through right at this point in time. And obviously, acupuncture and supplements, which you can talk about.
Yes, and we'll get to that part coming up. But let's answer again some of the we'll try to clear up some of the misconceptions or questions we got around when can you resume treatment. So we talked a little about telehealth, but let's talk a little bit about the ASRM recommendations too.
Yeah, well, as I said before, the ASRM recommending that nobody sort of seek retrievals now or IUIs, that all that sort of be stopped temporarily. And I think it was not meant to be discriminatory against patients who have infertility while the quote normal patients are home making their babies. That's not what they meant. They actually wanted to decrease, people exposure to other people and to, obviously keep the staffs and reproductive clinics healthy, et cetera, and obviously decrease the virus, spreading further. I think that was their real goal here. But, I think they've anticipated these problems, and a lot of leaders in our field have expressed real concern about those recommendations. And they've reached out to the society with a rather lengthy letter displaying what their concerns are, that basically, people could be home trying to make their own babies and, who don't have any issues, while infertility couples are not allowed to go through. and especially ones that, are older, who have decreased ovarian reserve, or people who are in mandated states who have insurance and who these people may be losing their jobs. And, finances are going to be a big problem now. And that's probably one of the major problems that, we have to bring out, is that finances to pay for these things. Obviously IVF is expensive. A lot of times it's not covered. But, in people who have coverage, people are unfortunately going to lose jobs and they won't have the coverage anymore. What do we do with all these people? Well, I think in certain situations and certain circumstances where people are appropriately counseled, I think some of these people are probably going to have some treatment probably, but, we are not as doctors, we are not telling people to, resume treatment right now. And, unless they've obviously been appropriately counseled, they've signed informed consents. But we are trying to stick to the guidelines as much as possible. And we are trying to make sure people stay healthy and quarantine themselves and don't expose themselves unnecessarily. And while the month or two wait is, as I said before, is probably not going to be a big deal for most people, as long as you're doing something positive. So we're not encouraging people to go through treatment at this point. That is, that's definitely not what we're doing. But again, there may be certain circumstances where people are going to go through, like people who have decreased ovarian reserve, maybe a couple, or if they have cancer, God forbid, or there's some real reason that they need to go through. I think some people will, or they're already in treatment. But, again, we are trying to adhere to the guidelines, and we recommend that you adhere to the guidelines as much as possible and keep yourself as healthy and ready to go when it's going to start up, and hopefully very soon. Hopefully very soon. Because it looks like these curves are bending a little bit and things are stabilizing. At least down here, I don't see the numbers expanding. And maybe, they say the peak isn't for another week or two, but, hopefully if they could keep people from, getting too close to one another and social distancing continuing, I think we may be okay by May or June. That's my feeling. But again, I'm not the expert.
Yeah, we don't know. We know that the more we can keep ourselves healthy too, that's really important. And so we're going to spend the next few minutes talking about some action steps you can take. This is actually a picture of your office doing telemedicine. And
that's not me.
That's not you, but it's one of your colleagues doing telemedicine. Right. And this is what it looks like whenever, we have the same system where you can click on the website and on our homepage, we have our pictures there, and you can enter the waiting room, and we actually do a session, our telemedicine straight from the website that way after you make an appointment. And then you guys also have a similar setup too, right? Where you can call the office, they'll give you a telemedicine appointment, and then chat. And I feel like it's been kind of, I don't know, it's nice. Like you said, we have a little bit more time to actually dig a little deeper, and we can do some detective work before you actually start a full cycle and that sort of thing. We can really optimize.
Yeah, it really is very, very good. It actually is pleasant. It's and it's very secure, and it's just like having a patient in your office. It really is very, very good. So I encourage people to do that. Have a telemedicine visit. It really works well.
Yeah, and plus, when you think about all the things that go into getting your hormone levels tested and getting all these things ready to go, and sometimes we have, there's issues with aligning or there's things like that. It does take a little bit of time, so it's a good time to actually start that anyway, start the process. And we're going to talk a little bit about now, we're going to get to my favorite part about what we can do right now to improve our fertility. And we aren't talking about anything that's hard to find or anything like that. This is actually our preconception plan that we use with our patients. And this is our 4-step process that's been very, very successful over, the last, let's say, 16 years or so, working with fertility patients and really helping them, the first thing that we're going to do is use evidence-based protocols that actually lead to better outcomes with medicated cycles. And we also want to avoid wasting time and wasting money as well. So we're not using everything under the sun. And we've also had that experience sometimes where it's kind of like you read a blog or you are looking through your kind of online and chat rooms, things like that. And what works for someone is not necessarily going to work for everyone. So we really start with what has been shown to be the most effective. And basically to reduce frustration, because infertility is extremely frustrating, as we all know, and there's definitely some things we have learned throughout the years that can be very helpful. So getting that consultation is important, and then also taking the steps necessary to really take action on what you can do now that's going to actually help when you do get started, whether it's naturally, IUI, IVF, whatever your plan, donor cycle, you know, there's many things you can do. And when we don't have a plan, that's when the frustration can set in. Basically, you feel like you're spinning your wheels. You're not sure where to start. And sometimes putting off effective treatments that could be helpful can be a real issue. What we hear a lot of times is, I wish I would have known about this sooner. And that's when we start, you know, with, oh, did you know that it could be helpful sometimes to do some, you know, CoQ10 or fish oil, but you need to take that at least 2 to 3 months prior if you're trying to improve egg quality. It's not going to be effective if you're only taking it for a few weeks, right? So now we have this beautiful opportunity to be able to really help with, you know, those things as well. And this is what our process is. It's basically gathering your team. We're going to talk about that, discovering the issues and really doing a little bit of prep work to treat the root causes, and then just taking action. It doesn't have to be something that, you know, is a perfect step, but you're just basically taking some action step. It doesn't have to be jumping into a cycle either. It could be just scheduling that consultation, or, you know, kind of collecting everything, all your labs that you've had done throughout the years and all those things. So just taking an action step. So, you know, when we talk about gathering your team, we are recommending, if you've been experiencing issues with trying to conceive, or you've had multiple miscarriages and it's been, you know, 6 months to a year where nothing's really happening, it is a good idea to get a consultation with a reproductive endocrinologist, even if you're not contemplating IVF, because what they can test for are things that your OBGYN usually will not test you for. And those are, you know, things that could be inflammatory markers. There's so many things out there that honestly, sometimes you don't really realize it until you get a full workup. So, so definitely that's important. We also want to stress, in the meantime, especially now with all of this COVID-19 and pandemic stress, to look at mind-body issues, because the brain communicates with the ovaries, and then the ovaries communicate back to the brain, and then you have a nice, hopefully very positive feedback between the two. So if we're under a lot of stress and if things are just not going well, sometimes that can influence our cortisol, which can influence all our other hormones. So, so we definitely work with some mind-body techniques as well. And then, you know, you might want to consider working with an Oriental medicine practitioner or acupuncturist to work on herbal formulas as well in the meantime. You know, those formulas are really specific to your condition. So what we do on our visits with our telehealth visits are basically looking at the complexion, looking at symptoms, checking the tongue. We can't check your pulse, but we can check pulse rate if you have a blood pressure monitor, that sort of thing. But also we look at, you know, what we can do to support you with herbal medicine as well. And there's some really great formulas that are out there. They've been around for, you know, hundreds and hundreds of years, treating issues with hormonal imbalances and also fertility that we incorporate. And then also we're going to look for the supplements that actually are proven to be effective, that I know Dr. Gelman uses in his office, and certain and a lot of clinics will implement. But again, you have to have time for them to work, because that's it's an issue, right? And so so your teammates are going to be each other, right? You and your partner, they're going to, it's very important to have that support. And if you do have it, then that's awesome. And if you are pursuing fertility fertility treatment and you do not have a partner, I hope that you can reach out to friends and loved ones and have a support group as well, because this is something that is overwhelming to go through if you're alone. So, reproductive endocrinologists, reproductive acupuncturists, nutritionists. So obviously you don't have to have everybody on this list, but this is just an idea of some of the things that we, some of the tools and some of the providers that we communicate with and that we recommend. Mind body practitioners, I've had really great success with just patients getting into yoga, and they're just, I know Dr. Gelman's a big yoga fan too, so that's really important to have some routine and some release, some pressure release, so you can actually be able to cope with stress in a more productive way. And sometimes we are looking into group support. There's actually I believe I saw today on the Resolve website, there's actually several different support groups that have come up. We've also established one as well during COVID-19 that would be helpful. And also psychologists as well that work with patients who are undergoing fertility treatments or have experienced losses. So, and I just want to make a little, hopefully inspirational story that on our Instagram live last week, Dr. Wood and I were talking about FSH and AMH and that sort of thing, where you can kind of get into a depression sometimes when you think about, okay, this is my number, my AMH is low and I'll never get pregnant and it's just, not going to happen for me. Well, we did have a patient where her AMH was extremely low in the zeros. And so she actually was told that she was going to need donor eggs. And she had been trying to conceive for 2 years and she was 35. She actually waited about 6 months, honestly, to go back because she was devastated and thinking, okay, I'm going to just have to take a break. I have to think about this a little while. She waited 6 months. She did acupuncture supplements, got healthy, lost weight, got on a Mediterranean diet. Her AMH actually, it went up. And I know that people think that's not possible, but it actually did. It went to 1.5 and she conceived a healthy baby girl just with IUI on the first try. So I'm just giving you as, some sort of, hopefully some inspiration to let you know that you're not a number. Numbers are not everything. And, we have to treat the person, not the number. So
Right.
That's what I like also about Dr. Gelman's practice as well, is that, they have the ability to look at the whole picture. And so I don't want you to get discouraged. So some of the causes, we talked about them briefly, but, we'll talk about as far as all these reasons, just to give you an idea that it's not always so straightforward. You could have multiple reasons. You could have 2 out of 3 out of 4 overlapping reasons. And I'd say the more reasons you have, the more intricate and more delicate the testing has to be, and the more experienced the practitioner should be. Do you agree, Dr. Gelman, about that?
Yeah, I mean, a lot of these things, we look for a lot of these things, and there's a fair amount, obviously, of certain one of those things versus others. But I would say that female age and egg quality is very, very common. Obviously, male factors can be common. Autoimmune, less common. Non-ovulatory, very common with PCO. Tubal factors, fairly common. Endometriosis, very common. Uterine issues, much less common. And unexplained, probably endometriosis on most of those cases. So we do see a fair amount of those things. And sometimes we just don't really know what the problem is at all. It's really unexplained.
It can be, yeah. But it seems like it's getting less and less because we seem to say, a lot of times there's a natural killer cell issue, or there's, other things that you guys are discovering too. So an autoimmune factor, but And so step number 2, that's important, right? This is things that you can do now. You can look and you
Yeah.
can get your blood drawn. You could talk to someone, talk to your RE about doing these panels and looking into, doing your charting at home and getting that information uncovered, right? Doing ultrasounds, things like
Yeah,
that.
because all these things, involve a lot of blood work and, testing, things like that, which can certainly be done during this time. We obviously want to limit your visits and things like that, but, I mean, a lot of the labs can be done at once. And then, it can be gone over by virtual consult, for follow-up in terms of how to manage any of those problems that we come up with, what we should do about them. And now's the time to do it. And now's the time to make your plan and, to get the stress out. So you know where you're going. By the time you're ready to go after this thing is over, if you're waiting, you have a plan. You've looked into all these things. We know what to do, and we can accomplish those things. And then that previous slide, it was very important because you'll show later on in the slides on AMH and things like that. Number isn't everything. So sometimes the AMH can be very misleading. AMH is the number of eggs that you would have at any point in time, and we compare it to your age-matched controls. It's not always the most accurate thing. There's plenty of times that an AMH can be very inaccurate depending on the lab it gets sent to. That previous person might have had a very inaccurate AMH in the first place, and then, she came to us, she had an accurate AMH, and she had the proper nutritional and acupuncture therapy, she gets pregnant.
Yes.
So, there's always those things. You can't always say everything's set in stone, and it's not always the case. And so, and if you were given a diagnosis, diminished ovarian, doesn't mean you cannot get pregnant. So that's what I'm trying to emphasize is that, and this is a very important slide, develop your game plan so that you have a plan when you're ready to go. You know exactly what to do and where you're going because you have a sense now of what the problems might be. And you've been taking care of yourself and getting yourself healthier so that you will have a much better response to the IVF or IUI process, whatever you're trying to accomplish.
Yeah, definitely. And the testing you are still doing, if you're still doing ultrasounds in the office under all the OSHA and CDC precautions and all of that, and able to do blood work. The BBT is something that I know some people think it's old school, but I kind of like to do it just like 1 or 2 cycles with patients who are at home and they're able to check their temperature just to see what the pattern is looking like. And sometimes just doing that simple thing, it's free. You should already have a thermometer at home, hopefully, and added benefit, you can see if you're getting any fever as well. Hopefully you're not, but that's that charting is what we also go over, and you can use that with ovulation test strips at home to see if you're ovulating. And you'll see that biphasic pattern on that BPT chart correlate with usually a positive LH ovulation test strip. So, and then, reproductive acupuncture, we are on a case-by-case basis right now of treatment, but with acupuncture. But if our patients are not able to come in, we are able to give them some acupressure to do at home. We actually put a video together for some fertility acupressure points that are helpful that you can do with each other as well. So definitely there's some benefit in addressing circulation and stress. So I want Dr. Gelman to talk a little bit about this slide. This is actually, we're getting to the point where, we do see this in practice. It's important to talk about, but it shouldn't be a scary thing. It's basically just, where we need to sometimes think about ramping up our treatment a little bit more aggressively in certain cases. So.
Yeah, I mean, this slide obviously is a scary thing, and people have seen these things, and and they're saying, "Oh my God, I'm 37 or 38, 39, 40, and look, I'm starting to go down. The cliff is starting to, get longer and more steep." But this is really only the chance per month, on your own. That's not really chances of getting pregnant. I mean, obviously, your chances of getting pregnant per month decline because egg number, egg quality declines. But again, age isn't necessarily, a factor in all cases. In most cases, I mean, we can see, sometimes there are people who are, 35, 36, who obviously have very diminished ovarian reserve, but conversely, we see people around 40 who have very good ovarian reserve, but the issue obviously then those people may be egg quality. But that doesn't always mean they can't get pregnant. They may need an aggressive approach. So I would look at this and just say, hey, listen, it's true statistics, but it doesn't necessarily apply to you as an individual, of course, depending on your age. It has to be, you have to be looked at as an individual and what other factors are going on, what other medical problems you have. Is there male factor? Are there tubal factors? Is there endometriosis? These things all have to be taken into account. And look at the IVF data here. It's still that's 2014 data. It's very good data, actually. You could see it, at age 38 to 40, it's still 35, 40% success rate, which is good. I mean, that's as compared to 15% when it first started. And still, even if you're 40, 41, there's still a reasonably good chance of success, in 28 to 30%. So, I mean, I would not worry that much, even if you're delayed for a month or two here, as long as, again, as you're trying to help yourself and keep yourself healthy and do the things that we're trying to outline here. I think that'll be a good thing for all you people who are listening. And obviously acupuncture, look at the effect of acupuncture and how much benefit you can get on your pregnancy rate and decreasing miscarriages even, which is a very surprising thing. I mean, that was actually a surprise for me when I first saw that slide on how much it really reduces miscarriage risk and ectopic pregnancies. I mean, that was pretty amazing.
Yes, and the acupuncture is implemented at the transfer a lot of times, and we think the purpose of that is to calm the contractions
the uterus.
and also to relax.
Yeah.
Yes.
Yeah,
and I
because
remember
that's
years ago, like
deal.
you said like, oh gosh, look at the cervix, so relaxed. I think I was in your office doing acupuncture during a transfer one time, and it's like, look at this. It was so easy to insert that catheter, and usually
it makes it so much easier when you have acupuncture like that. And definitely, because people can still get ectopic pregnancies during IVF. We want to obviously reduce those because those are catastrophic in some cases. But the data, and when I first saw those slides, I couldn't believe it. And that really kind of sold me more on acupuncture. Was that, it was amazing how it works. It's really good. It's really something all you should consider. And this is what I was talking about before, AMH, the numbers here tell you, and those are, fairly good averages, but, I don't think they're really stratified that well according to age here at all. We have a special lab we work with called Unilab that actually did a lot of standards over about a 10-year period and standardized all the AMH levels according to your age. So if you come to our office, you'll get an AMH through Unilab, and it's a very accurate value. It really tells you what your ovarian reserve is. But again, it can be misleading, and it may not tell you the whole information that you want to know. Obviously, if it's good and a good level, it's reassuring, but sometimes a good level may not always reflect good egg quality either. So it doesn't tell you anything about egg quality at all. And FSH is the old standard test that we look at, which varies month to month. And that level can be very inaccurate in telling really what your fertility potential is.
So I know that some of those statistics, they can be a little overwhelming, but again, like we said, you're more than a number. So that's just a reference to look at whenever you're going in and doing all the research and getting your labs done at this particular time, just so that you can kind of have a baseline. And again, those numbers can fluctuate too. So that's why we say if you have 4 to 12 weeks to prep for pregnancy, like you would plan for a wedding, right? People spend more time planning their wedding than they do trying to get pregnant. So we say, look, if you have that time, let's work on some nutrition, getting some good supplements in, exercise, stress reduction, and medication if needed, right? You could have a thyroid problem, but you won't know that unless you get your thyroid checked. And you need to have your TSH at a certain level before you get pregnant. You don't want to be working with that after you're pregnant. And so that is why we stress that. So give yourself some time. And, obviously, as soon as you start thinking about having a baby, it's important to eat a balanced diet of healthy foods and take a preconception vitamin. So we all know that folate is really important. It's sometimes hard to get, and a lot of vitamins they don't contain the right type of folate. So we're constantly checking the vitamins when people come in going, okay, if this was bought at Whole Foods or if it was, GNC or over the counter, sometimes they're good, but they're food-based perhaps, and they're not having exactly what the type of folate that everybody can absorb, since there are some issues sometimes with folate absorption, and that's really important. So this is what we look for in a good prenatal. This is high quality. This is actually from Theralogics. We use their prenatal vitamin. I know that everyone has their preferences, but I think that it works very well. Our patients do like it a lot. And this is kind of what, and I'll put that information at the end, but this is what we look for, and looking at, adequate levels of certain types of minerals. And I have to say, we've had so many patients who are low on hemoglobin and are anemic and just have never really notice that. Isn't that crazy? Like, I just years and years of walking through life and very, very tired and not really knowing that they're anemic. So, and then lo and behold, when you look at the prenatal, it's got very little iron or maybe no iron, so that's really important to address that, because going into pregnancy already anemic, you're really going to feel wiped out. So, so this is my top 5 favorite ones. Dr. Gelman might have his favorite ones, but I think we overlap in a lot of ways. And we know that, a good prenatal, a good ubiquinol, CoQ10, a good high quality omega-3, vitamin D, and a greens drink that's really important. So even if you don't do anything else, these are obviously we'd love to get, nutrition in through food. But if you're not doing anything else, these are really the things that we recommend the most. And we give all the guys a multivitamin, at least, so that they're able to do their part. And so that's something that, do you want to add anything to this, Dr. Gelman? Or?
Well, yeah, I mean, I think those are good, obviously. And then if you have diminished ovarian reserve,
we're going to get to that one.
yeah, we'll use those at higher doses.
Yes, we have a few of the details for that. But and so this is basically our ways to improve ovarian health. Definitely we mentioned stop smoking. Smoking is horrible for egg quality and for your fallopian tubes as well, and also for your lungs, right? You definitely don't want to be smoking right now. So and then even marijuana, they've actually come up with a research study about that as well, not being good for egg quality. That came out yesterday. So I think that we knew that, but now it's really actually showing that we routinely ask that question also of the partners. We don't know the effect that has on sperm, but it's important to know that, hey, look, now's the time to put that aside and really focus on cellular health. So, moderate exercise, not over exercising, but just kind of getting, good 30, 45 minutes a day. And if you can walk, that's great too. Some, like I mentioned before, Chinese herbal medicine would be helpful, antioxidant support, and we talked about the others as well. So when Dr. Gelman was speaking about, egg quality health, and he also, I think, recommends DHEA in certain cases as well, right? And so there's a few things here that that would be helpful according to research. So this is all evidence-based. The studies are actually at the end that we've cited, but this is also Theralogics provided this to us tonight, and I think it's a good reference as well, because there is something to taking melatonin now with the inositols. So they did a study, and for patients that did that for 6 weeks, their egg quality improved when they took those two together. So I think that is something that is actually helpful for sleep as well. Melatonin and myo-inositol powder is also helpful. It's tasteless. You don't taste it at all. People just mix it in with their shakes mostly. And it's safe. So those are just some recommendations. You could take a screenshot of it and if you want. And then as far as the approaches we talked about before, these are all really helpful as well. So I think, like, to sum it up, really, if you can set a timeline, I think it's great for your stress level to say, we're going to try for X amount of months. And if nothing happens, then we move to plan B. And if that doesn't happen, we move to plan C. And somehow it just takes that burden off your shoulders of, like, just not knowing and just being more and more frustrated every month. So, you know, try to get your diagnostics done, and, you know, then figure out, like, okay, let's give this a try, or let's try on our own, or let's do something, but let's get that information and have the data to really know what the best result is. So best approach is, so that you're not, you know, saying, oh, I wish I would have done this sooner or known about this sooner. Because that's what kills me when I hear that. So you had anything else to add to that, Dr. Gelman?
No, I think that's what we're trying to say is, you know, just one point about the supplements, you know, the DHEA and diminished ovarian reserve. There's some good studies, some good, you know, a little bit anecdotal, but there's some decent studies that show that 25 milligrams of high quality DHEA, pure DHEA, 3 times a day. It's 25 milligrams 3 times a day. It can't be 75 milligrams once a day. And coenzyme Q10 of 600 milligrams, high doses. L-arginine would be another one. Fish oils, like we said, 2 to 4 grams a day of EPA oil. All important to take for a period of time, for a minimum of 6 weeks, preferably 3 months before you start. So if you're in a position of waiting and you have diminished ovarian reserve and you're worried, this is the perfect time to do those kinds of things, combined with acupuncture, stress reduction program, healthy eating. That will give you a much better prognosis. And, you know, waiting a month or so really is going to benefit you, actually, and not necessarily harm you. So I think that's the approach we're trying to get out there, is that unfortunately we have to deal with this thing. We all have to deal with it, but we have to be smart. We can work our way around it, and we can do things to improve ourselves to make our outcome better. But now's the time to put your plan together, just as Farrar was saying. You know, get your team together, get everything together, get yourself a positive attitude, and to focus and say, this is what I'm going to do, this is what I'm going to accomplish, and do it, because now's the time to do it. You're home, you know,
Yes.
and don't worry. The main thing is don't worry. And yes, yoga. I'm a very big believer in yoga. Fantastic.
Yeah. Yeah. And you can do some, you're doing virtual yoga, right? You like, what's
Yeah,
that?
you can get some great things online, you know, some great yoga programs online, you know, some are very, very tough. I mean, you have to be, you know, been doing it for a while. Some are easier. They have easy ones too. You know, any basic ones, you know, mostly for stress reduction, I think would be perfect. And a walk, a daily walk. Won't cost you a dime. Go out and take a walk, get some fresh air, get out of your house. Perfect thing to do.
I'd like to take some questions, and I'm actually, I had a few that were emailed in, but I wanted to actually ask you guys a favor. I know I said use the question tab, the Q&A tab, but for some reason I'm not able to see it on my screen. So if you don't mind typing in the chat your questions, that way I can see them, that would be great. And I apologize for that, but I'm not able to see them. So if you guys can do that, that would be wonderful. Thank you. Oh, yeah. Okay. So I want to get to her question right now. And I know there was another question in the Q&A. So if you're still on, if you could please post that in the chat tab, that would be great. And feel free, anybody else who has a question, to go ahead and get that there in the chat. So Aya says, I am Dr. Gelman's patient. I will be doing an IUI over the next month or two. You mentioned earlier that they were asked to stop procedures for the time being. Has the Cooper City office stopped doing IUIs for now? No,
they haven't. So people can go through. We have not been, you know, ordered by the government to close or anything like that. Reproductive medicine is a necessity, you know, it's a necessity. And we are doing that. Again, people are being, you know, cautioned about this virus out there, and you know, we don't know fully all the effects, you know, that kind of thing. If should you get sick, you know, while pregnant, et cetera, et cetera. I mean, the results so far seem fine, but you know, we're not sure about a lot of things. And what will happen is that you'll have to sign a form stating that you were, you know, made aware of all these things out there, and that you wish to go through. So, you know, people are going through, but, you know, we're not over encouraging people to do anything right now. We're encouraging people to, you know, be smart, and to do what they feel is correct in their particular situation, to quarantine, to stay healthy, and, you know, to do the things we try to outline here, and to be safe.
And also, she's asking in regards to RE hormone testing, can that be done at Dr. Gelman's office?
Absolutely. All hormonal testing, whatever it may be, could all be done. You know, any kind of panels, reproductive panels that can be done, PCOS panels, autoimmune panels, immunology panels, whatever you need, we can do. And whatever your insurance doesn't cover and we have to send you to a lab, we'll just email you a prescription and we'll send you to the lab and we can get it done. So we'll work with your insurance too, you know, so nothing has to be done specifically in our office. We could actually send you to a lab too.
And I want to mention these resources. The Resolve National Fertility Association has a page for support. Oh, thank you. I appreciate your question, and I hope that we'll see you soon. And we'll love to speak with you further. And so, Theralogics also, that's the link there if you're interested in any of those the supplements we are discussing. Also, the ASRM has a patient tab where you can actually go and get the most updated information as well, since they're constantly, you know, the situation's constantly evolving.
Yeah.
So I hope that, you know, we've answered your questions. I know that we just had a couple of questions that were emailed, so I'm going to actually just go to our email questions really quick. And this one was from Yemi. She said, trying to conceive and prevent miscarriages with PCOS is very challenging. How is COVID-19 adding to these challenges?
Well, I'm not sure COVID is really adding to the miscarriage risk and things like that, but we're not sure about the effect of COVID in the first trimester, and other than, you know, high fever and things like that could affect things. But obviously the stress is not going to help anybody, you know, carry a pregnancy. And, you know, I think stress is the big intangible here. And, you know, whether that, you know, and that's part of the problem of miscarriages, you know, when you have one or two, you're always stressed out, and that obviously adds to the inability to conceive, I would think. But PCO, again, I mean, some studies have shown potentially an increased risk of miscarriage from PCO, especially if you're severely insulin resistant, or pre-diabetic or anything, or you have inflammation or anything else going on related to PCO. So that should really be checked. I mean, if you haven't had an inflammatory panel, a PCO panel, autoimmune panel, recurrent pregnancy loss panel, you need several panels to evaluate why you're miscarrying. Also a saline histogram, make sure you don't have a septum. You know, so there's various causes that have to be looked for. I don't know if your gynecologist had done some of those already. But
yeah, that's
I
important.
wouldn't say COVID itself, other than the stress of the whole situation, is not going to, you know, necessarily increase your risk of miscarriage.
Yes, and keeping our immune system healthy is another question. What can be done to help with that, since the vitamin C supplements are sold out? Yes, zinc, vitamin C, and probiotics are kind of hard to find.
Definitely. Zinc, you know, I would probably take a minimum of 100 milligrams a day of zinc. Now, some studies say up to 5 grams a day of vitamin C. Now, that's a pretty good dose. I mean, if you have healthy kidneys, you don't have kidney stones. If you can get the vitamin C, I'd probably take at least 2 grams a day, maybe 3.
Yes, and vitamin D actually is still.
And vitamin D, and as a matter of fact, there was a study that came out that showed 10,000 IU of vitamin D prevents the virus from binding to the receptor on the lung where it binds, the angiotensin II receptor. Apparently, vitamin D blocks that. So vitamin D might be something to really consider here.
Definitely, we've been recommending that to all of our patients.
Yeah, I would think about high dose vitamin D too. You know, it's safe stuff. I mean, you're not going to have a problem with that.
Excellent. And now would be a good time to get
elderberry. I would probably add elderberry if you can get it.
Yes, and we do have a few probiotics and things like.
Yeah, probiotics for sure.
actually tomorrow night, Dr. Wood and I are doing a Q&A on
On what?
on Instagram on our page. So you can join us there. You can call Dr. Gelman's office at the number we have here, and feel free to give us a call or send us an email if you have any questions at all. And I hope that that answered your question. So there's like one more question coming in, and okay. Oh, what is the most urgent? Talking about timing. So Gina's just getting in a quick question before we call it quits here about, thank you, Christy, for attending. Thank you so much. I'm reading all the comments here. Thanks, Lori. And timing is, yes, about, I think she maybe is referring to, sorry, one question from Aya, where do we get information about acupuncture? You can go to floridacompletewellness.com, and we have the information there. We have podcast episodes with Dr. Gelman as well, and we have some information on research about acupuncture and fertility as well. And then also you can book a free consultation online with us too, a 15-minute consultation to kind of answer any more questions that we probably didn't get answered today. So yes, at Florida Complete Wellness, or you can call the phone number here. And so as far as, okay, limited amount of Eulos, limited amount. I think she's speaking about timing, maybe like if she's concerned about if she runs out of time, perhaps. I'm not sure, but I think.
Or limited ovulation, she has an ovulation problem. Well, that's a perfect time to get a consult and find out why you're not ovulating or what your problem is.
Yeah. Ultrasound, right, would be great to do.
Ultrasound, labs, PCO, maybe she has PCO, who knows?
Yeah, great. Yes, so be your own detective. That would be my advice. Please be well, everyone. Stay healthy, and I really look forward to doing this again sometime. And thank you, Dr. Gelman, for.
A pleasure. Hopefully see some of you soon.
Bye, everybody.
Good night. Wow. You still there?
Yeah, we're just closing up right now. Let's see.